Hello, everyone. This is Dr. Siddharth Tambar. Welcome to our webinar today. Today's talk is on our physician-assisted weight loss program, specifically utilizing semaglutide and a peptide approach. So I'll talk for a little bit. Please ask your questions, and I'll answer as we go along. After we're done, you'll get a copy of the webinar as well if you need to rewatch it or send it to a friend. So, we're talking about semaglutide, which is really treating obesity, and the scope of that problem globally is obviously huge. And it has a profound impact on cardiovascular health, metabolic health, immunologic health, and overall well-being. It's estimated that, per the World Health Organization, about 8 years ago, that about 650 million adults worldwide were estimated to be obese. In the US, as of 2020, it's estimated that about 42% of adults are considered obese, 9% of children. And, realistically, that number's gone up probably in the last 4 years. So today we're talking about a physician-assisted weight loss program option where we're utilizing a product called semaglutide to address obesity and all of its associated health effects. So, the problem with obesity, besides cardiovascular issues, is that it has a lot of other health complications as well. So we definitely understand the cardiovascular effects, high blood pressure, increased risk of heart disease. It compounds so many of our musculoskeletal problems, including pains in knees, hips, ankles, and lower back. Every day, right, I see so many patients who have pains in those kind of joints and areas, and we really need some better options for treatment that help with what's driving a lot of this, including weight loss. Metabolic effects in terms of type 2 diabetes, insulin resistance, hypertension. In terms of immunologic or immune system issues, folks who have obesity have higher risk of infections, and it can also worsen some autoimmune conditions, whether that's psoriasis, psoriatic arthritis. I've certainly seen RA patients where they have higher rates of inflammation because of obesity, and some of that is improved as they've actually lost weight. There's definitely a link between various cancers and obesity as well, and of course, sleep apnea as well, which then also leads to other cardiovascular problems that you see with sleep apnea. So in looking for better solutions for weight loss, we know that obesity has a lot of long-term health issues. We need better options for treatment. Traditional methods, there's a yo-yo effect. Diet and exercise are essential, definitely, but they're not adequate for many people. And the conventional weight loss strategies can help, but they're not always sustainable, and people tend to yo-yo back and forth with the conventional strategies. And that struggle is on multiple levels, whether it's biological, psychological, environmental factors. It's really a lot of different levels. And so diet and exercise is essential, but a lot of us need assistance on other levels as well. So our program does certainly provide a comprehensive approach to address obesity and improve overall health. So when it comes to goals of treatment with this kind of program, it's really not only weight loss, but it's also improving body composition. That means when you lose weight, you lose not only fat, you also lose muscle mass. And so the key is, how do you maintain muscle mass as you're losing weight? That's a key part of this. Improving cardiovascular risk factors, improving your metabolic risk factors, meaning your blood sugar regulation, improving exercise capacity, so key when it comes to musculoskeletal health and cardiovascular health, improving eating habits, because that is what's going to help out long-term, improving your immune and gut health, and improving sleep and stress management. All of that is really important when it comes to your overall health as well as weight management. So when it comes to diet, there's really 3 different ways that your dietary choices can help with weight loss in general. So you can just eat less total calories, right? And the idea being that if your output is greater than your intake in terms of calories utilized, then you'll have weight loss. You can also utilize what kinds of foods you eat. The challenge here is that what kind of foods? So I think while the American College of Rheumatology for autoimmune patients says that people should focus on a Mediterranean health diet, which makes sense, in the general population, the general press, social media, when you look at what sort of diets people recommend, it is extreme. It's anywhere from people that believe in a vegan no oil diet, right? No animal products at all, to a carnivore diet, which is only animal products. So there is such a drastic polarity in terms of what people recommend. It's really all over the map. And then, of course, there's eating only specific periods of time, right? So, that's what people think of when they think of intermittent fasting. Intermittent fasting basically means that you only eat during specific periods of time, and then you're fasting the rest of the time. So, realistically, we do, to some extent, we're all doing some version of intermittent fasting, meaning we're not eating when we're sleeping. So, but traditional kind of intermittent fasting strategies are maybe your last meal is at 6 p.m. and your first meal is at 10 a.m. It makes a lot of sense because it does certainly lead to better blood sugar management. It does also lead to weight loss. The concern is that, and it's, that form of dietary management is one that a lot of people can do because it doesn't really require dramatically eating less, doesn't require skipping out certain foods. It just requires eating all your foods during certain hours. And there's a lot of value to that in the sense that we probably shouldn't be eating late at night. That's probably better if we don't have high blood glucose at nighttime or while we're sleeping. The challenge is that, there may be other effects. So there was a study that came out that suggested that if all you do is intermittent fasting, there is a chance that it may increase the risk of cardiovascular disease. That's not totally flushed out because there's other possible issues associated with that study. But the idea being that just focusing on one nutritional strategy, while it can help with weight loss, it may not be adequate when it comes to your overall health. And so ideally, you'd be utilizing all of these techniques, meaning you would be reducing the amount of intake compared to your calorie usage. You probably would be eliminating certain foods, and you probably should be restricting when you're eating to some extent. And all of that together is a lot to do. It can be hard to do. And semaglutide is something that can actually help maintain that kind of regimen. So peptides are really an innovative therapeutic tool. So peptides they're naturally occurring molecules that you have in your body. They act as what's called signaling molecules in the body. So what that really means is that you have proteins in the body that tell other cells what to do. So the most really kind of popular one that people know of right now is GLP-1, glucagon-like peptide 1. So that is a naturally occurring gut hormone that regulates your appetite, insulin secretion, energy metabolism. For weight loss, there are other peptide targets that are now coming up. So semaglutide works on GLP-1. There's other meds that are starting to come up that are also targeting these other kind of peptides. So these particular peptides have a very key role in glucose homeostasis and insulin secretion. They regulate your blood sugar levels by stimulating insulin release, and they reduce glucagon secretion and thus reducing your blood glucose as well. So they have not only a key role in blood glucose and diabetes, but also your metabolic health overall. So semaglutide is really a potential game changer in weight loss, and that's for a few reasons. Number one, semaglutide is a GLP-1 analog. That means that it mimics the effects of your naturally occurring GLP-1. And it's been shown to have a remarkable improvement in promoting weight loss and improving metabolic health. So it works by improving your blood sugar homeostasis so that you're pulling blood glucose out of your bloodstream, putting it into your muscles. It reduces how fast food gets through your system in your gut so that you're not really, that sensation of fullness happens a little bit faster and it's not kind of wearing away as fast. And it overall reduces your appetite. The kind of chemicals that are associated with hunger are reduced because of GLP-1, and the chemicals in your body that are associated with feeling full are promoted as well. And all this essentially means that it helps to promote your body's normal way of feeling satiated. So the mechanisms of action are slowing down stomach emptying, reducing your hunger sensations, helping you feel full sooner, reducing food cravings, food preferences, and thoughts about food. So semaglutide is FDA approved for type 2 diabetes and chronic weight management. So in chronic weight management, it's approved for folks who have a BMI greater than 30. I think we all know at this stage that BMI, it's a little bit flawed in terms of measuring health, overall health, but it's kind of a good general marker that's followed throughout medicine and studies. And so a BMI greater than 30 is one that certainly meets criteria. A BMI greater than 27, and if you have one other weight-related comorbid condition. So that means if you've got high blood pressure, diabetes, cholesterol, osteoarthritis, fatty liver, prediabetes, heartburn, PCOS, hypogonadism, and asthma. So all those are associated with obesity. And if your weight is a little bit higher than normal and you have some of those other issues, semaglutide can help. So other future potential preventative indications. This is interesting because there's data coming out. Well, how does it help with preventing cardiovascular disease? That's interesting. How about if you've got prediabetes? So if you're a woman and during your pregnancy, you had gestational diabetes, that means your blood sugar was running a little bit high, then you're more prone to diabetes long-term. How do we help prevent that from happening? Neurodegenerative diseases, it's been looked at even in Alzheimer's patients. Anti-aging, that's an interesting idea. If we can improve your metabolic health, can we slow down aging in general? And then metabolic syndrome, of course. How do we prevent people from getting diabetes, fatty liver, high blood pressure, heart disease? So semaglutide is really this first medication. The dosing for this is a weekly injection that you give yourself. It's pretty easy to do. We can show you how to do that. The key is you start on a low dose, and then every month as needed, you keep on increasing it. So, it's important to do this in a safe way. And that means you don't want to do this too fast. You also don't want to do it too slow. There's sort of a right and proper way to do this. And to do this properly from a medical standpoint, we monitor your weight, your appetite, and observe for any side effects. And we're monitoring your metabolic health labs every 6 months as well. So semaglutide offers a sustainable weight loss plan that is within reach. So there's very compelling results from clinical trials. So multiple clinical trials are now showing that semaglutide offers really substantial weight loss and safety. So there's studies that are now going out to actually over 2 years, showing that folks will achieve an average weight loss of anywhere from 15 to 20% with semaglutide. And that if you stay on the treatment long-term, you'll actually maintain your success long-term as well. If you combine that with healthy nutrition and regular exercise, you'll get an even better result. And that's key because number one, if our goal is to help you maintain this long-term, it is in large part by making sure you're doing the right nutritional aspects and regular exercise. So from the nutritional aspect standpoint, semaglutide is great because it'll help regulate you in terms of preventing you from overeating. And if you're trying to make difficult nutritional changes, semaglutide will help because you're not going to get as much of the cravings for some of those other foods that you've been missing. Regular exercise is obviously key because how do you maintain your body composition, your muscle mass, your muscle strength, which on its own helps with weight loss, but then also helps with body composition and helps with some of the other issues that you see in obesity as well, whether it's wear and tear arthritis or other issues. Safety profile, if you look at data that goes out to over 2 years, semaglutide looks to be safe. And the most common side effects seem to be some mild GI issues, nausea and constipation. The keys are you start at a low dose and you slowly increase. That's the key here. And what happens is that first month, you'll notice that, okay, you're not as hungry. You may have a little bit of nausea to begin with on the low dose. Your body should get used to it after a couple of weeks. You'll probably notice a few pounds of weight loss after that. If you're tolerating it, we then increase the dosage the next month. And you keep on doing that for the first several months to get you to kind of a target dose. Some folks will do this where they're just sort of ramping up the dose every month until they get to the max dose. That's a little bit too fast and it's not really necessary for everyone. It makes more sense to just slowly, incrementally go up. And then if you're doing well and losing weight at a safe and appropriate level, you don't want to lose it too fast, quite frankly. You want to lose it in a nice, consistent manner. And if you're doing that, then it's okay to slowly ramp up. If you're having too much side effects or if you're losing weight too fast, then you want to kind of ease up on the dose increase. Again, keys to optimize treatment. You combine semaglutide with exercise and nutrition. Again, eating nutrient-dense food, avoiding overeating, exercising. You have to do both cardiovascular exercise to assist with weight loss and improve your metabolic health, but you should also be doing some strength exercising as well to prevent muscle loss as well. Looks like I've been kind of answering questions as I've been going along. That's good. Please continue to put in your questions as we're moving. Some other frequently asked questions that I hear from people include the following. Some of these I may have already kind of answered, but so how long before you start seeing weight loss? So most people should be noticing weight loss within that first month. In the initial phase where you're kind of ramping up for the first 12 weeks or 3 months, you will probably notice some weight loss in the first month, and then a little bit more than month 2 and a little bit more in month 3, right? There's kind of a progressive increase as you increase the dosage. So you should be noticing something even as fast as the first month. But again, we always say slowly increase it for the first 3 months, and you should be noticing that. How much weight can I expect to lose? The studies show on average 15 to 20%. Some people should be able to do more than that. How long do I need to continue treatment? We recommend doing at least an initial 3 to 6 months, see how well you're tolerating it. Studies show that semaglutide is really most effective if you're using this long-term. And by long-term, that really means like on an ongoing basis going forward. When you're on a long-term dosage, however, or maintenance treatment, you can be utilizing either a lower dosage or you can be utilizing this less frequently. So maybe instead of taking it every week, you're taking it every 2 weeks or every 3 weeks. So there is some maintenance dosing that gets into consideration long-term as well. But the evidence shows that this seems to work best if you're taking it long-term. So do you need to eat healthy and exercise when you're using these medications? Of course. You should be doing that. That's good for your general health. But you'll get an optimal result for weight loss and metabolic health if you're able to eat healthy and exercise as well. And again, semaglutide can help you establish those better eating habits so you can benefit longer term. In addition, we've started to work with a nutrition and health coaching service called Flair Health, where they're actually pretty helpful, where you work with a nutritionist and a health coach, where they're helpful for helping you get to that kind of healthier habits and then helping you to maintain that as well. I think I've read that it takes about 90 days to kind of maintain or to establish a healthy new or a new habit or a new pattern. And so I think working with a coaching service to help establish that within the first few months, I think is very helpful as well. So can semaglutide make your muscles and bones weaker? When you lose weight, the reality is that you lose both fat and muscle. All right. Your body kind of burns through both. And so the focus is really to improve your body composition. And by that, we mean by making sure you're doing the right exercises, right? The resistance exercises, weight-bearing exercises, and then eating the right sort of healthy foods that help to maintain your muscle and bone health. So there is that risk as you lose weight, but as long as you sort of do the right kind of exercises, you can help prevent that from happening. So if you stop treatment, will you regain all the weight? I think that's a frequent question that was just asked as well. So a couple thoughts. So the first is there is actually a study out there that shows that when they stopped semaglutide, they stopped exercising, they stopped eating healthy, people regained 2/3 of the weight loss that they'd had. Now, it's a strange study, right, that this was published in, because if you want to maintain your weight loss, why would you stop exercising and why would you stop eating healthy? Like, that doesn't make sense. I think if you're trying to get off the treatment, number one, switch to a maintenance dosing, and that means using a little bit less frequently. And then you have to maintain the healthy eating and exercise as well. I think if you do that, you're more likely to maintain the weight loss. The reality is that this is different than some of the earlier weight loss drugs. Some of the earlier weight loss drugs literally amped up your metabolism. And that sounds good in the sense that it would sort of burn off weight. The reality is that amping up your metabolism has other potential issues, right? Like it increased the rate of heart disease, arrhythmias, things like that, other problems like that. And so these new meds don't work like that. They really work more just by helping to control appetite, blood glucose, and how your body basically processes food. So should you use semaglutide long-term? again, the evidence shows that you maintain weight loss and metabolic health if you use this long-term. The safety data to date is now over 2+ years. And again, you can use a lower dose and frequency as maintenance. And again, like, how does this compare to the prior weight loss meds? The prior weight loss meds didn't work as well. So semaglutide leads to more weight loss, and semaglutide seems to be safer as well. So there's the reason why people are excited about some of these newer options. And when we're talking about semaglutide, we're talking about Ozempic and Wegovy, right? And so Ozempic and Wegovy right now are really easily available for diabetes. They're really not available by insurance for weight loss, which is why we're doing this kind of program to help make this available for people for weight loss as well. There are other versions of these GLP-1 agonists that are coming out where they target other peptides as well. Tirzepatide is one. There's another one that's coming that tirzepatide targets 2. There's another one that's coming out that targets 3 different ones as well. Semaglutide is nice because, number one, it's the one that seems to have the longest data right now. It's been the longest studied, and it works well. Most people tolerate it well, and it works very well. Number two is that it's also more cost-effective right now than the other options right now. So it's still the one that we go to first, but in cases where we have folks that have already tried, like we've had a few patients where they've already tried Ozempic, and either they had an issue or they just couldn't maintain the effectiveness of it, where we've now transitioned them to tirzepatide, which is it affects 2 different receptors. So semaglutide is still kind of a good first-line option for these treatments as peptide weight loss because of all the data and how well it works. So for our program, here's what we're offering. Essentially, it's a physician-assisted weight loss program, really focused on a personalized approach to weight management, utilizing the efficacy of these peptides. Obviously, first, thoroughly evaluating you, making sure you're an appropriate candidate. We're trying to be safe and do this without harm to begin with, making sure that you're guided through this in a appropriate and professional manner, closely monitoring you to make sure this is done appropriately so that you're not at risk for any health other issues, regular lab monitoring roughly every 6 months or so to make sure that, as you're losing weight, as things are changing, that you're not deficient in things like vitamin B12, vitamin D, you're not becoming anemic, that all those kind of things. And again, we've started to work with this health coaching service called Flare Health, where I'm kind of excited by this because I think they offer a really helpful approach to weight loss as well, based on the nutrition aspect and making good healthcare choices. So here's what our program is. So the cost for this from us is $450 per month. It includes the monitoring, the medication, and the supplies. To learn more, to get checked out, to see if you're an appropriate candidate, you can either go to what's listed on the website there. You can also click on the QR code here that will take you to that website as well. Despite being obese, it is not covered by insurance. Despite being, yes. Here's the thing. The FDA, so the medical data shows that this is safe for weight loss, even if you don't have diabetes. And for the FDA has given the approval for weight loss as well. But insurance is not currently covering this for weight loss. They're covering it for diabetes if you failed multiple other treatments to begin with. I think they're worried about opening the floodgates. It would dramatically improve the healthcare for Americans. I mean, it would really dramatically improve our rates of heart disease, diabetes, musculoskeletal problems. It would really be pretty life-changing if they did that. But unfortunately, that is not, our healthcare system is a little bit odd. It doesn't always sometimes give people what are the best options. And, my sense is that for folks who have tried to lose weight and, they've done the typical things, whether it's dieting and exercise, and they're just not quite able to get there. And the reality is, as we all get older, based on changes in our metabolism, hormone levels, all of that, the reality is that, some things that maybe worked when we were younger, 20, 30 years old, right? Gets harder when you start getting over the age of 40, 50 years old. It starts to get a little bit harder. And so, this is a treatment option that is very helpful in that regard. Great. Any other questions at this time before we kind of wind down here? Okay, excellent. Well, thank you everyone for your time. If you'd like to watch a replay of this, you'll get a chance to do that. You'll get an email for that. You can also check that out on our YouTube site. And if we can be helpful, please let us know. Again, in the chat section, there's a list of all the different ways you can reach us if you need to, or if you have any other questions, please email us at any time or call us anytime. And until we connect again, I hope everyone stays healthy and lives well. Bye-bye.